Many of my students find selecting relevant information from the case notes the most difficult thing about OET writing. So watch this video because I'm going to show you how to do this. Let's go! Hi, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means you are in the right place for your OET. Don't forget to subscribe to our YouTube channel, hit that bell so you're notified every time we post a new video. Let's begin. The OET writing is profession specific, so you will be writing as a doctor to another healthcare professional. You are given a set of case notes and 5 minutes reading time. You then read through the case notes during this time, but you can't write anything. Once the 5 minutes is up, you have 40 minutes to write your letter. You are given an answer booklet, which looks like this, with 2 sheets of line paper to write your letter on, and a sheet of blank paper, which will not be marked, and you can use this for planning and notes. You will also be given a test booklet with the case notes and another blank page, which will not be marked and can be used for notes. So what kind of letter will you be asked to write? Let's take a look at the different possibilities. There are 3 different types of letters that you may have to write in the OET exam. You might have to write a referral letter, for example, to a neurologist, a physiotherapist, surgeon, an occupational therapist, an endocrinologist, or a dietitian. You may have to write a discharge letter where you could possibly be writing to the patient's GP. Or perhaps you might write a hospital admission letter where you are writing to, for example, psychiatric hospital or a children's hospital. Now let's take a look at how to approach the writing with this step-by-step guide. Step 1. Look at the case notes and find out who you are writing to and why. This is essential because it will help you select relevant information needed for the reader. Step 2. Decide what information is relevant and what information the reader doesn't need to know. Step 3. Make a plan. Decide on a logical way to group the information together in paragraphs. Step 4. Write your letter. Use clear language to summarize the important information and leave a line between paragraphs. Step 5. Check your letter for errors and make sure you've included the key information. So let's put this in action with a set of case notes. Let's begin with step 1. Look at the case notes and find out who you are writing to and why. We can see that you are a doctor at a city clinic and Mr. Adam Knowles is a new patient in your surgery. You need to write a referral letter to Dr. Desai, a gastroenterologist. And the reason for writing is in the task. You need to request an assessment of the patient. And if you look at the plan or the last consultation, this can help you decide what information to include. So here we can see we need to request an assessment and specifically an endoscopy. And why? Because you suspect pancreatic malignancy. It's so important to understand why you are writing, as this determines the information you select. So let's take a look at that now with step 2. Decide what information is relevant and what information the reader does not need to know. We know that we have to request assessment and an endoscopy due to possible pancreatic malignancy, which will mean we have to include some supporting details. We need to include his name and date of birth, but his marital status and profession is irrelevant. His physical activity is not so relevant, but the fact that he socially drinks and possibly his history of smoking might be useful for the reader. And from the medical background, we can see that the only relevant information to include here for the gastroenterologist would be his gallbladder removal. The other conditions are not related, but you might think it's relevant to include his current medication. Now look at these consultations. Which information do you think it's relevant to include from these dates? For the visit on the 2nd of August, we should not include all the details. The relevant information to include would be the initial presentation and treatment of omeprazole. Nothing abnormal was detected in the full exam, so no need to mention it. And there's no need to mention the previous weight and the ordering of the tests and review. We should focus on the outcome of these and what's relevant to now. And this is presented in the next consultation, where we can see the results of the pathology report, the outcome of the tests. If we look at 30th of August, this is the most recent consultation and contains important information. So this should be summarized clearly. And finally, we have the plan of action, possible diagnosis, and we need to specifically request assessment and an endoscopy. We don't need to mention the discussion though if we say the patient is aware of the possibility, so we want to avoid repetition. Step 3. Make a plan. This will help you stay focused during your writing time, and you can use it as a checklist to make sure you've included the relevant content. There is no set way to organize an OET letter. You need to group the relevant information together in a logical way in paragraphs. So here we have an example plan. Paragraph 1, introduce the patient, situation and reason for writing. Paragraph 2, relevant information from the most recent visit. Paragraph 3, relevant medical history and the progression of symptoms. Paragraph 4, request. Now that you have your plan, you should move on to step 4, write the letter. Make sure you use clear language to summarize the important information and leave a line between paragraphs. To summarize effectively and avoid including too much detail, focus on the outcome. Let's compare these two sentences. Which one is summarized better and focuses on the outcome? The first example contains the information the reader needs to know, and it is written concisely. The second example, however, has included a lot of detail and reports too many details about the process. Finally, step 5, check your letter for errors and make sure you have included the key information. You can use your plan as a checklist to make sure you've included all the relevant information and become aware of your repeated language errors. Check for these first rather than just reading through your letter. For example, if you know you often make mistakes with articles, then look for this first. So let's take a look at a sample letter for the Adam Knowles case. We can see that the letter has been laid out correctly with the name, address of who you're writing to, the date, the greeting and the reference. Familiarize yourself with the correct layout to use, as this will help you score high for organization and layout. The first paragraph introduces the patient and reason for writing. To score well in the purpose section of the criteria, it's essential that the reason you are writing is immediately clear in the first paragraph and sufficiently expanded throughout the letter. In the second paragraph, we can see that the most recent relevant symptoms and situation have been included. This is effective because it prioritizes the key information, so the reader can understand the situation and the doctor's concerns. In the third paragraph, we can see a history of relevant symptoms and their progression. There is also a clear timeline as well as effective summarizing with linking expressions to communicate the information clearly and effectively. In the following paragraph, we see useful information before the final paragraph, which has the plan of action, and an appropriate polite request phrase has been used. Sample letters can help you while preparing for your OET exam, so you can see how to express the purpose effectively. Understand what relevant content is. You can also notice effective language to use when summarizing, as well as clear organization and appropriate language to use. And here are some examples of useful language for OET medicine writing. Phrases for introductory paragraph or the reason for writing. Phrases to use in the closing paragraph. And phrases for making requests. Practice using them and write lots of example sentences in different contexts. Top tips for OET writing. Look at the task first. Keep in mind the purpose of the letter as you select relevant information. Summarize the information effectively, plan your letter before writing, and remember to check the errors and succeed in the OET exam. What phrases do you know to introduce a patient at the beginning of a letter? Let me know in the comments below. And if you like this video, like and share with your friends and colleagues so we can help more people achieve success in the OET exam. See you in the next video. Bye! Many of my students find it difficult to select relevant information in the case notes. So watch this video where I show you how to do this in an easy way. So in this video, I'm going to show you an easy way of how. So watch this video where I show you how to. Oh my God. If you're not already subscribed, make sure you are to our OET channel. No. Oh, I have to do the whole thing again. So let's take a look at that now in step 3. Is it step 3 or step 2? In step 2.